Holy cow, folks. Republican Senator Roger Marshall claims that the Republicans will have a comprehensive health care plan unveiled by December, and I want you to hear some of his ideas in this clip.
Let's take that $150 billion we're giving insurance companies, give about a third of that back to patients, to consumers, to set up their own health care savings accounts. Beyond that, there's work to be done with roll back the PBMs when it comes to prescription drug prices. Trump RX is going to be something else that'll work. We can expand access to association health care plans, to ministry plans as well. We want to set up high-risk pools, reinsurance pools in every state as well. So there's a lot of things we can do. These are not new concepts. Speaker Johnson and I have been working on this together for years.
So, well, you've been working on it for years, but is there like a comprehensive plan that people could look at and decide whether or not they think it's something that Republicans should pass?
We'll have something within that when we'll have a side-by-side bill when they come out, when they get their vote on Obamacare subsidies, giving.
You're going to have a health care bill by the second week of December?
We will. We've been working on this very, very hard for several years.
Now, nobody is arguing that there needs to be significant reforms to pharmacy benefit managers or PBMs. They're like the middlemen of the medication supply chain and can significantly drive up costs of health care. On the other hand, though, what's really concerning about that clip is the fact that I've heard this time and time again from Republicans that they're in favor of taking that money that is used for the enhanced subsidies for the Affordable Care Act and then giving it back to people to buy their insurance plans and moving towards different risk pools. That is something that we had prior to the Affordable Care Act, where there was a high-risk pool where if you had a pre-existing condition, you would be put into that pool and your premiums would be astronomically high, or there could potentially be caps on the number of people that could even be eligible for health insurance. So you may be put on a wait list and not be able to get access to health insurance just because you have a chronic condition. Look, unless the Republicans are in favor of a universal health care option, which we know they're not, going back to what it was like before the Affordable Care Act is not a viable option because millions of people will not be able to afford their health care coverage and will end up getting sicker as a result.